The Swedish Public Health Agency conducts annual seroepidemiological examinations to determine the presence of antibodies capable of detecting the COVID-19 review. The surveys were conducted on multiple occasions between 2020 and 2021 and included the collection of surplus samples taken from outpatient care and blood donors. Antibodies to SARS-CoV-2 were examined in excess blood samples taken from outpatient laboratories in 8 regions during the final week of May and the first week of June. Blood samples were collected from children, adolescents, adults, and older adults ranging in age from 0 to 95 years. Antibodies were detected in 85% of those aged 65 to 95 years, 52% of those aged 20 to 64 years, and 28% of those aged 0 to 19 years. The entire group had an average of 52 antibodies. As might be expected, there is a large number of antibodies in the older age groups, where vaccination has advanced significantly. Given that only a small proportion of this age group has had COVID-19, this demonstrates that the vast majority of people who have been vaccinated develop detectable antibodies, according to Mia Britting, unit manager at the Swedish Public Health Agency. Additionally, 52 blood donors had antibodies during that study period. This is an increase from early March 2021 surveys, when 1 in 4 blood donors tested positive for antibodies. The increase is being attributed to the fact that many people have received at least 1 dose of vaccine since then. Youth antibodies were detected in 28 of children and adolescents aged 0 to 19 years in a survey of blood samples taken in outpatient care during the last week of May and the first week of June. The highest rate was found in the age group 16 to 19 years, where 37 had antibodies. However, it was lower in the 0 to 10-year age group, where 22 had antibodies, and in the 11 to 15-year age group, where 34 had antibodies. Vaccination rates among children were, as expected, extremely low during the corresponding period. An additional 30 of 11 to 19-year-olds had antibodies. The study was conducted in late April and early May. The study group was unvaccinated at the time. According to our research, just over 30 of young people have antibodies against COVID-19, but 2/3 do not. It is essential that young people understand that COVID-19 can still spread within this group, according to Mia Britting.